Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hey everyone, it's Amy Brenner, MD, and today we're here again with Jack Reed of INMODE, and we're going to take an in-depth look at Morpheus8. It's one of our most popular treatments in aesthetics. I have a feeling it's kind of popular around the country, and so we're going to dive deep into talking about Morpheus8. So welcome back to the podcast, Jack.
Hey, thanks for having me, Dr. Brenner. Pleasure to be back.
So before we get into it, we had you on before and we talked about Votiva and you gave your background. But if you haven't gone back and listened to that episode on Votiva, could you give everybody a little background of who you are and what this company INMODE is?
Yeah, so my position at INMODE, so I'm the Director of Client Operations here. I've been with INMODE for just about 5 years and been in this space for almost a decade now. So it's just something that I've kind of been doing for quite a while now, and I'm really passionate about it. I'm passionate about helping practices like yours succeed and get the messaging out there to your patients. INMODE in itself, we're probably the fastest growing med tech company in the space, and I would say due in large part to Morpheus8, what we're going to talk about today. And I don't want to steal your thunder and get into a lot of different things before you start asking questions, but I'm really passionate about the company itself. We have a variety of different systems and handpieces and platforms. Obviously, we talked about Votiva in the women's health space. Now we're about to switch gears and we're going to talk about something that you can use really all over the body to help improve texture, skin tightening, a bunch of other stuff. But, the company itself is, we manufacture all of our devices and then, we distribute and sell directly to providers' offices like yours.
Yeah, Morpheus is, I would say, after Botox and filler, I would say it's our most popular aesthetic treatment. But for people that don't know what Morpheus8 is, can you explain to people what is it?
Yeah, so let's take a couple steps back. So everybody pretty much knows who has dabbled in the aesthetic space, gone to med spas, gone to plastic surgery offices, dermatology offices. They know what microneedling is. This has been around for quite some time. So microneedling, you're just shooting these little pins into the skin, creating little holes, damage around the skin, and then the skin itself will just heal around it. And then we also have a device, it's called Forma, and this is just radio frequency. So it's just bulk heating. What regular microneedling will do is help with textural concerns. You'll need a number of treatments with just a standard microneedling device to see improvements with textural concerns. And then with Forma, our other device, which is just radio frequency, it's just heat, that's helping with skin tightening. Now, if we're going to combine both of those, which we're doing with Morpheus, and we're going deeper than anybody else in the space, we're able to not only just create dermal injuries and put these pins in, and then the skin can heal around it. But as we put those pins in, then we're also introducing the heat at the same depth. And so with a couple different Morpheus8 tips, we're able to either go to 0.5 millimeters, or we can go all the way to 7 or 8 millimeters in depth. And so when you're going that deep and you're also introducing heat, you're able to get great improvements with skin tightening, great improvements with surgical scars, acne scars, stretch marks, cellulite reduction. So again, very popular treatment. This is something that a lot of celebrities endorse, and this is completely unsolicited endorsements. We are not paying for these endorsements by the celebrities at all. They're just doing it pretty much, I guess, pro bono with the offices that they're going to. If anybody's familiar with Kim Kardashian, I'm sure most people are, kind of a household name. She's been one of the people that has spoken a lot about Morpheus over the past couple of years. So again, she calls it her favorite quote unquote laser treatment. Morpheus isn't a laser per se, it's radio frequency, which there is a difference there, but nonetheless, she seems to like it a good amount.
Yeah. So you said Morpheus can go from, say the depth again.
So 0.5 millimeters,
Yep.
and that would be obviously a very
So
superficial
half a
depth.
millimeter. That's like almost microscopic.
Yeah. So really good for like fine lines, not deep wrinkles, but just fine lines, and just general resurfacing. And then it can go all the way to 8 millimeters with the heat profile. That would be more for like, the body. So abs, flanks, legs, that sort of thing. But most commonly, people are using this for 1 to 4 millimeters on the
Mm-hmm.
face and neck in other areas of the body too, just to get great textural improvements, skin tightening. It's been awesome, and I've gotten it myself. My wife has gotten it. We both love the results, love how it makes us feel. So,
So I love
I
your
mean, we're in.
analogy of Morpheus is combining regular microneedling with heat, but regular microneedling does not go 4 millimeters deep. So you're not going to get anywhere near the kind of results that you can get with Morpheus.
Yeah, and I think with regular microneedling, there's a place for it out there for the patients that, are not ready, for, say Morpheus, right? Because this is a true aesthetic medical treatment. You're going, maybe 4 millimeters in depth on the face and neck. You're going to be topically numbed prior to. This is something that is, this is a great treatment. And, some people, say beauty is pain. I didn't see a ton of discomfort when I got it done myself. My wife, she's got a pretty good pain tolerance too. She didn't either. But there are patients out there that say, hey, there's a little discomfort. And that makes sense. You're shooting these little pins into the face, introducing heat. Naturally, some people aren't going to handle that as well as others. So that's good to know too, just so patients know kind of what they're signing up for and what they're getting into, that, there could be some discomfort during the
Mm-hmm.
treatment, but other patients seem to get through it just fine.
Yeah, I think it's interesting. And before we got on the call, I mentioned that I had a series of 3 a year ago, and then I just did another one last week. And it is interesting. I'm on the opposite end, like you and your wife. Like I have zero pain tolerance, and my experience of doing this with patients is there's some patients that we put the topical numbing cream on, and that's all they need, and they're like, "Yeah, I'm good." We offer a lot of other things in case patients have zero pain tolerance, like myself. We use this nitrous oxide inhalation device that just helps with pain control and kind of makes you feel like you're in la la land or you don't really even know what's going on. Sometimes we'll even put some lidocaine under the skin, or because we are a medical practice and have physicians and nurse practitioners here, if somebody's really concerned, we actually sometimes, very rarely, but can prescribe actually pain meds to use during the procedure. Hardly ever anybody needs that. I don't even need that, but we have those as options because it's interesting. Some people think it's, well, nothing. And then other people think it's, moderately uncomfortable.
Yeah, and I've heard that across the board. It's funny. I definitely wasn't like, oh, this is a walk in the park, but it wasn't something where I was like, stop doing this right now. I can't handle it. But it's important when offices like yours have a number of different modalities. Whether it's Pronox, the gas in solution that you were talking about before, very healthy, safe. It kind of just like pushes that pain away, right? Like just kind of puts it in the background where they're not really thinking about it. Um, some people do just great with topical numbing. So, you're going to see a variety of patients out there. And you'll be able to tell pretty much by either just knowing them already, or if they're new and they're just kind of talking about what their tolerance is, you'll know how to treat them at that point. But yeah, Morpheus has been a game changer for our company and for all of our practices that have purchased it and came on board with us. They're all doing very well. And it's really nice just to see the patient response too, not just the celebrities and the Kim K's and that sort of thing, but also just the normal patients that come in and write great reviews on Google or Instagram or Facebook, and just engage with you. It's great to have a product that works so well and is able to get people confident, because it's not just about aesthetics and feeling good, or I guess not feeling good. Feeling good is the best part, but like it's not about just looking the best. It's really about just feeling your best. And acne scars is a huge one, right?
Mm-hmm.
People are so self-conscious of that, or maybe it's surgical scars or stretch marks, and this is something that can really even help with that, something that people don't just see as they're walking around every day, but maybe it's when they're on vacation and in their swimsuit. So really great to have a product that works so well and is able to give people that sort of confidence.
Mm-hmm. So it's amazing for acne scars, but you also do get, I call it almost like a non-surgical facelift, because you do get a lot of skin tightening with it.
Yeah,
Um,
that's the big bonus. That's where the heat comes in. And so we talk about it, and we use the phrase a lot, shrink wrapping, right? Maybe you do a neck treatment or a face and neck, and after even sometimes just one treatment, and after my first treatment, I felt that my skin was more contracted than before. And again, I don't know if it was just a psychological thing, but I felt it and it looked better. It looked healthier. And so, it's one of those things where, yeah, you're able to get that skin tightening, that shrink wrapping effect when you get these treatments. And, more often than not, you're not just getting one. It's not supposed to be a one and done. We want people to definitely get at least three. That's where you're going to see the best bang for your buck. That's where you're going to see the best results. And that's where it's going to really prolong the results as well. So getting, probably three treatments is the sweet spot for this.
yeah. And then I recommend, I got to be honest, I obviously am the owner of our practice in Medi Spa, and I have these smile lines, and I'm like, I'm so upset that I haven't done a better job of taking advantage of the things I have in my office, and that I let myself get these lines, because it's so much easier. Like you mentioned Kim Kardashian doing it. Like, why is she doing it? She has perfect skin. But it's so much easier to prevent something than it is to treat it. Um,
And
so
I think that's where Morpheus really shines. And when talking about like a demographic for this treatment, right? It's really not for your 40s, 50s, 60s. I mean, of course, everybody can use it there, but it really shines with the even younger demographic, right? Like now people are so health conscious and they're still doing Botox and fillers, but they don't want to do as much Botox and fillers. They want to do something that's more of a natural solution. When you're just putting pins and heat, in a different area, face, neck, body, that's natural. That's allowing your body to respond to the mechanical interaction that's going on there with the heat, with the pins, and then your skin thickens, your skin tightens, and then, maybe you don't need as much Botox. Maybe you
mhm,
don't need as much filler. It's not going to, it's not going to disrupt that industry by any means. But for a lot of patients, they're going to do Morpheus first, and they're going to get their skin to tighten. They're going to get better results with textural improvements. And then they'll go to an office like yours and they'll get Botox and fillers. Um, for my wife specifically, she said that she doesn't use as much Botox as she once did after she got Morpheus done. So There's that. I'm completely putting her on blast right now. She has no idea that I'm even talking about her like this. So, but it's true. When you're doing a treatment like this, it can totally be for preventative reasons. You want to prevent, from down the road, right? When you're in your 60s or 70s and you're starting to see your jowls sag and your neck sag a little bit. They call it like a little waddle underneath your chin. At that point, it's almost too late, and you do need something that's more surgical, right? Like you could still do Morpheus and get a good result, but surgical result will probably be the best bet for you because at that point, it's just been prolonged. But when you start doing this and you get this in your treatment regimen when you're in your 30s, 40s, lower 50s, like you'll be able to push out that facelift in those, minimally invasive or invasive procedures much longer.
Yeah. What I love that you mentioned doing Morpheus before filler and Botox, and I couldn't agree more because when you're doing Botox and filler, which again, I love those and you get almost instantaneous results, but you're renting it. The filler's going to go away after a certain time. The Botox is definitely going to be gone in 3 to 4 months. So you're kind of renting the results versus when you do something like Morpheus, where you're stimulating your own collagen and elastin, you own it and you have it forever. Well, maybe not forever, but you're building your own collagen. Now, certainly, none of us are frozen in time, so that collagen and elastin that you do get from Morpheus could also decline with age, but you own it. It's not a certain time frame like Botox or filler where it's going to go away. Um, and yeah, in an ideal world, like, again, I'm so mad at myself. Like, why didn't I do better about doing all this for myself? But it's not to say that it can't give you great results if you already do have wrinkles or sag or something like this. It's definitely not, like you mentioned, it's not a replacement for a facelift. And so people that are candidates for a facelift, it's important, I think, to set appropriate expectations. But a lot of people don't want a facelift. And so this, either alone or sometimes actually combined with threads, we've been getting pretty darn close to some of the results you get with a facelift with those two modalities.
Yeah, yeah. Again, it's not going to take the place of, a surgeon's hands and pulling the skin back like that. Make no mistake about it. But certainly it can either prolong you having to get that treatment done. Like you said, you use Morpheus in conjunction with threads. I think that's a great methodology, great treatment regimen for patients. But it can certainly help. And you're right, patients nowadays, they do not want to go under general anesthesia. They do not want to have weeks of downtime. I remember before, a lot of companies and a lot of patients always talk about, CO2 lasers. And again, CO2 lasers, there's still a place for them. And if patients don't know what CO2 lasers are, they essentially ablate the entire top layer of the skin. And so, depending on how aggressive you go, you can almost look like a burn victim once you get that done. And if you go aggressive enough, you can. And there's days and weeks of downtime with those procedures. Now, the results are outstanding. Mm-hmm. So make no mistake about that. But who wants to be, unless you're retired, who wants to have that downtime of, 10, 14 days where, you can't go out in public, can't go out in the sun, you can't go to your gym class, that sort of thing. Or if you're still working at this time and you're maybe even working in a remote capacity, you can't even do Zoom calls unless you turn your video off, right? So, with Morpheus, you can get very aggressive with the settings. And yeah, right after the treatment, of course, you'll be red, you'll be flushed, you'll be a little swollen. But after 24, 48 hours, you can almost not even tell that you had something done. But underneath, that's where all the magic happens, right? So right. The skin starts to heal pretty rapidly. And then underneath, everything's pretty much just working. And so the skin's beginning to contract, it's beginning to thicken, the textural improvements, everything's pretty much starting to even out. But again, It's not just a one and done treatment. Yeah, you'll probably see some decent results. You'll feel it. But really the best results come after you do roughly 3.
Yeah. So we do a couple of things in our practice to kind of accelerate the healing process. We use this carboxy mask, which is using basically infusing carbon dioxide into your skin, and we put it on everybody immediately after the Morpheus, and then you can also, as an add-on, choose to do some at home. So like when I had it last week, we put the mask on right away, and then I did another mask later that night and the next night. We also sometimes will put platelet-rich plasma or growth factors on for an enhanced result and enhanced healing. So like when I had it, I literally went to my daughter's volleyball game that night, and you can tell, like, one of my friends said, I knew you had something. I thought you had a chemical peel, like you were a little red, but it wasn't that. I stayed home even the night of the procedure. And then the next day I got some mineral makeup and went to work. So
Yeah, and it's awesome when practices like yours have a number of different things, whether it's medical grade skincare, everything else that you're doing within the office to either speed up the healing process, or you've got these open channels, right? So you're thinking, why not do something with that? Why not, enhance the result, enhance the skin tightening effect, enhance the textural improvements. And so you're doing, even more. And that's the beauty of this device, and the beauty of your practice, and everything that you offer, being able to do that as well.
yeah, so you have those, like, again, you drove a needle into the skin, so there's literally like almost like a hole in the skin. So, we have it as an option where we can put growth factors or things like that to enhance the healing that go into those little channels and get absorbed by the skin rather than just topical application with like your regular skincare. Before we started, I said, is it in my head that it's been a week and I already feel like those smile lines I have are gone? Is that even feasible? Am I still swollen? Because typically I would tell patients, you're not going to start to see results until like the 3-month mark. But as a company, what do you usually tell your practices across the country of what they should tell their clients of when they'll start seeing the results, and also when do you get the final results?
Yeah, great question. And I think for most patients, and myself included, when I had the procedure done, again in my head, I felt that my skin was tighter days after. And I don't know if, again, maybe we're both just in our head about it. I don't know. I really don't. But I felt like my skin was more contracted. I felt like it was tighter. Excuse me. But it was for expectation's sake and for patients. I think it's good for them to know that typically after about a month, they're going to see tremendous results just after that first treatment. It could even be before that. It depends if they do, a deeper, more aggressive treatment, if they have maybe deeper lines, deeper wrinkles, maybe acne scars, that sort of thing. They could see it even before. But I always say, let's taper expectations. It is a 3-treatment protocol, so we're going to space these out 4 to 6 weeks. Patients can come in, get their first, month later they can get their second, month later get their third, and then typically, the skin is continuing to heal itself. It's continuing to remodel, and so roughly about 6 weeks, 8 weeks after that last treatment, they're going to see the benefits of the result, but your skin doesn't stop healing at that point. It's still continuing to thicken. It's still continuing to tighten. And so the beauty is, roughly 6 months after, your last treatment is probably where the results are going to be at its fullest.
Mm-hmm. Now, I recommend in our practice, like, you really, after you do this, because you invested in your skin, is I recommend to our patients to do something that stimulates collagen at least every 6 months, if not every 12 months, just to maintain those results. Is that what you're seeing other practices across the country recommending as well?
Yeah, I think this is something where Morpheus is, somebody can come in and they can say, "Hey, I'm starting to see some deflation, some sagging, naturally gravity's taking form and, pulling down." And so it can help address those concerns. But let's say someone comes in and they don't have that. They just want to, do it for preventative reasons. That'll work just fine too. But for all patients, this isn't something where you want to just get your 3 treatments and say, "Hey, I'm good." Nothing in our space is permanent, as you know. And even a surgical facelift, a tummy tuck, those are not permanent. Yeah, it's a one and done treatment, but you're still going to see deflation. You're still going to see some sagging over time. And so it's no different with Morpheus. The beauty is that it's non-invasive. The downtime is so minimal. You can get these treatments done. Say you come in, you get your series of 3, I would say, almost every year you should come in, get at least 2 more and
Hmm.
upkeep, upkeep. And, again, medical grade skincare products, everything else that you offer in your practice, continuing to upkeep with that. I think, skincare is so important with this and patients having, like, if they're going to invest, you know, $3,000+ in these treatments. They should protect that investment. And so I think making sure that they're, purchasing those medical grade skincare products, having, a great regimen. And I think you would agree with me, but sunscreen is essential. And so
Hmm.
making sure that, they're applying sunscreen, when they go out every day, will help with slowing down that aging process as well.
Since you brought up the sun, the other thing I like about this procedure is, it is still a procedure you can do in the summer when you have a tan. Um, Versus I was going to get a BBL, which is an IPL, and was on one of my nurse practitioners' schedule. I'm like, yeah, I don't think we can do this right now. I'm still too tan from the summer. Um, Versus, we don't have to worry so much about the darkness of your skin with Morpheus.
Yeah, and I would say, and we obviously have an IPL as well. We have laser hair removal devices. Typically, in our industry, it's seasonal, and right now, summer's winding down. It's almost over. But IPL, laser hair removal, not super common to have those treatments done during peak summertime, just because for the most part, you're always outside. Sun is at its hottest. Sun is out a lot. And so what you don't want to do is you don't want to put, you don't want to do an IPL procedure or a laser hair removal procedure where you're using a laser when your skin's already getting a lot of heat, already taking in a lot of energy already. With Morpheus, it's really nice because it's blind light. It doesn't see that those skin changes, and so you can treat in the summertime. You can treat all year round, honestly. So that's what makes this so nice. It's a really versatile product that people can use at any time of
As
the year.
well as treating people with color in their skin.
Yeah, so it whether you're a skin type 6 African American or you're a skin type 1, very pale. Again, this is a non-discriminatory product that doesn't see the pigmentation, right? So again, you can treat African American to the palest of Caucasian skin, and there's going to be no ill adverse events from that energy.
Yeah. Anybody that you would recommend not to have a Morpheus procedure? I know we talked about this with Votiva, but since we are using radio frequency energy.
Yeah, I mean, again, this is a very versatile product. It has a number of different settings. You can go extremely aggressive. You can go, pretty much. You can take it easy on patients and just give them an entryway into what this feels like. But again, there's a number of general medical contraindications on on our consent form. A lot of things just dealing with like, whether it be like pacemakers and, different things, but if they've got, instruments within their face, right? Like, or different areas of the body, what we don't want to do is we don't want to put this energy in areas where they've got, specific implants or metal. But typically, that's a pretty obvious statement. You're not going to treat anybody who's got maybe an object or some sort of metal, whether it be in their face or their abdomen. So we just want to stay away from that. But for the most part, this is a very safe product. It's obviously, the brand name itself, it's growing like crazy throughout the country. It wouldn't do that organically if it wasn't something that delivered incredible results and if it wasn't something that was extremely safe. So, with
And
that
certainly
being said,
we don't treat, not as a prior obstetrician, I can't imagine how it would hurt a pregnant or breastfeeding mother, but just in the aesthetic space, we tend to stay away from pregnancy and breastfeeding.
yeah, I think that's pretty safe. And for the most part, the women, probably know like, hey, I'm nursing right now. I'm going to wait until after to get some of these treatments done. And I think that's the best method to go about it anyway. Once you're done, if you've recently had a baby and you're nursing, definitely wait. Visit your office. You can consult with them and tell them, when they're ready. And that's a great little treat for them, as a mother to do this type of procedure.
Yeah. Well, thanks for joining us. Any final words on Morpheus for any patients listening, other than it's amazing and one of my favorite aesthetic treatments?
Yeah, I mean, I think for the most part, patients are starting to know what Morpheus is, and it's all word of mouth growth, and that's the best type of growth that we can have is organic growth with a product, and thanks to physicians like you that are putting the word out there and treating so many patients and delivering great results for them. That's why the brand has become what it has. But patients will love it. I think that they should go to whoever's listening to this. They should go to their nearest practitioner to get a consult and really see the benefits firsthand. I think they would really love it. But any research that they do, they're probably going to see glowing reviews from a lot of patients and practitioners that offer it. So we're just happy that it's in our portfolio and it's something that we offer.
Thanks for joining us.
You got it. Thanks, Dr. Brenner.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.